Good morning, goedemorgen. Mijn naam is Bram Bakker en ik ga vandaag een heel interessant gesprek voeren met Georgia Eat. Die zit hier naast me. Georgia is psychiater en Amerikaans, dus helaas moet het zometeen verder in het Engels. Maar dat vinden jullie niet erg, want wat zij te vertellen heeft, dat willen jullie horen. De aanleiding voor dit gesprek is het verschijnen van Heel je hoofd. En dat is de vertaling van Change Your Diet, Change Your Mind. Een boek wat in Amerika nu al heel succesvol is. En het in Nederland zeker ook gaat worden. Oké, Georgia, welcome. How do you describe yourself? Are you still general psychiatrist or... Yeah?
I describe myself as a nutritional and metabolic psychiatrist.
Okay, and maybe you can explain that because we don't have it in the Netherlands. we have something like voedings, psychiatrie, but nobody knows it. Nutritional psychiatrist.
Yeah, so there are these two new branches of psychiatry, nutritional psychiatry and metabolic psychiatry. In nutritional psychiatry, we believe that the so-called standard American diet, which is now everywhere in the world, including in the Netherlands.
Yeah. The standard world diet.
Right?
Yeah.
Exactly. Yeah. The standard world diet.
Pizza and Coke.
So healthy.
Yeah.
So we, people in nutritional psychiatry believe that this so-called standard American or global diet, that this is largely responsible for the very extreme rise in mental health problems of many different kinds around the world. And so the quality of our diet has been deteriorating, also the quality of our mental health has been deteriorating. So nutritional psychiatrists believe that making dietary changes can be a really powerful intervention in helping people with mental health problems. We believe in a food-first approach to mental health problems.
Food-first approach. That sounds good.
Yeah. And then metabolic psychiatry is an even newer specialty of psychiatry. And I'm also a metabolic psychiatrist. And we believe that our metabolic health, so in particular, glucose and insulin levels, paying attention to our metabolic health, that if we improve our metabolic health, we improve the way the brain produces energy. So the nutritional quality of the diet to give the brain all the nutrients it needs and not eat the foods that are going to damage the brain, that's the nutritional piece. And the metabolic piece is being aware of how your brain is producing energy. Is getting most of its energy from carbohydrate or most of its energy from fat. And there's a big difference in how the brain functions if you switch the fuel source. So that's these two fields I like to bring together in this book.
Okay. And we have last year already published Brain Energy from Christopher Palmer.
Yes.
Who you will probably know.
Yes, I do.
But how did you get there? Because I think in your training it was not very prominent.
Yes. Well, you know this yourself from having your own journey as a psychiatrist and practicing the conventional way.
Yeah.
Practicing the conventional way, which I did for 10 years, and you know very well, most patients don't get better. The treatments that we have are not working for most people.
Improvement is the rule, cure is the exception. I once learned.
Sadly, we were not taught, at least I was not taught, to expect full recovery for most people. That the best we could really do was using talk therapies and using medications was to help a little bit. But that most people were going to have a chronic, lifelong condition we were not expected to seek or aim for full recovery. And even when we tried our best with every tool we had, most patients were not getting better enough. And
complete recovery is so seldom, from my perspective.
I think that's true. But I think right now, really in the past few years, it's become a really exciting time to be a psychiatrist because we have these new understandings of the root causes of mental health conditions, not just these chemical imbalances, dopamine, serotonin, these chemical imbalances that we use medications to try to help with. But we're now looking at what is causing those chemical imbalances in the first place. Things like inflammation and something called oxidative stress, which is why we're told to eat more antioxidants, and insulin resistance, pre-diabetes, high insulin levels. These are the underlying forces that are causing a lot of these imbalances. And if you look at the standard world diet now, the ingredients in that diet directly lead to inflammation and oxidative stress and insulin resistance, which causes imbalances in the brain.
Yeah, and the neurotransmitters, let's make that clear, are never the root cause of the mental problems people are suffering from.
Exactly.
And that's why we went wrong, I think.
I 100% agree with you.
Yeah, so you're working in the time or the process, what went probably was lasting years already before the imbalance in serotonin and dopamine occurred. Is that true?
Yes. So, first, as you're saying, I want to make sure that people know that I 100% agree with you that these neurotransmitter imbalances are in most cases playing a very minor role. In some cases, not playing any role at all in the mental health condition. So, for example, with depression, there's the evidence for serotonin imbalance in the brain being the cause of depression is extremely weak. The science is almost non-existent.
It's even worse. There's scientific proof that there's no relation between the levels of serotonin and the way you feel.
Exactly.
But still, doctors, MDs in the Netherlands, GPs and psychiatrists still explain why they're prescribing SSRIs.
This is true in the United States as well.
Okay, it's still in the US?
Yes, absolutely. So the way most psychiatrists are practicing is even now in 2024, if a patient comes in with depression, you ask them a lot of questions and you take the history. And then at the end of the hour, if they have enough of the symptoms, then you prescribe a medication.
Yeah.
And most of these usually the first medication you'll start with is a serotonin medication.
Yeah.
Without running any tests or really knowing anything about the person's brain chemistry, because we have no good tests for brain chemistry. We're really just guessing. We're really just practicing in the dark and trial and error, let's try this medicine. Oh, that didn't work. Let's try the next medicine.
Yeah, we are trained in prescribing drugs. We are not trained in stopping drugs.
Exactly. In fact, when you use these nutritional interventions, which can be so powerful, we find that we need to, I teach clinicians how to use special diets in their work. And what I find that they need a lot of help with is reducing, how do you safely reduce the psychiatric medications once people start to feel better? That's something that we're not really trained to do in residency.
And you're also helping professionals to stop medications by change. Can you combine that?
Yes. So I'm glad you asked that, because it's really important to that we don't have to use diet instead of psychotherapy, instead of cognitive behavioral therapy, instead of medications, especially in emergencies. We can use a combination of whatever works well for that particular person. The diet works very well as the foundation for a better brain health, but not everybody is able to completely recover with diet alone. So it's important to be able to combine these different.
But you start changing the nutritional state, and afterwards you maybe can skip the medications.
Exactly.
That's how it works.
Exactly. Then once the person starts to feel better, you start to carefully, slowly reduce one medication at a time to see how low you can go. And in many cases, we are able to remove them completely, not in all cases, but we can usually make big differences in the amount of medications that people need to take.
Yeah, and there's nothing that works for everybody.
Exactly.
So that's never ever.
Exactly.
How did you find out about this? What happened in your life? You were treating anxious and depressed patients, and then what happened?
Right. So I was practicing normal psychiatry for 10 years, and I really enjoyed the work. But as I was saying, most people weren't getting better. So that was in my early 40s. So I'm 59 now.
20 years ago.
About 20 years ago, I started to develop some of my own health problems as I was entering middle age.
That helps. If you start with your own problems, I'm eating keto because I'm suffering from ADD pretty much. So that's how I became enthusiastic.
Right.
So what happened in your life? So it started with a personal experience.
Exactly. And so this is very motivating, right?
Yeah,
you want to try
for
to help
sure.
yourself. It's very selfish, but
if
that's
it's working for me, it must be working for my patients.
Exactly. Because you're really curious, right? So I had lots of patients who had the same problems that I was developing. I was developing migraine headaches and fatigue. They call chronic fatigue syndrome. Nobody really understands it. Irritable bowel syndrome, lots of digestive issues, and chronic pain. They called it fibromyalgia.
Yeah.
And lots of my patients were having these same problems, and I never knew how to help them with these problems. And then I started developing these problems myself, and so I started to go to all these specialists, these doctors. What's wrong? I don't feel good. I'm starting to have trouble working. I feel, like everything is falling apart. They did every test. Lots of tests.
And they started to prescribe corticosteroids.
They would have needed to prescribe 5 or 6 different medicines for all the different things. Yeah. But they all told me all my tests were normal. They said, nothing's wrong with you. I said, something must be wrong. Everything's falling apart. And I'm having trouble functioning and going to work every day. This is not okay. So because one of the issues was with the digestive system, I thought, okay, well, maybe that's about something I'm eating. So I just, started experimenting with my diet, just out of food list, symptom list every day in the journal to see if I could figure out, okay, what's bothering my stomach? And long story short, after about 6 months of making these changes, trial and error changes, I arrived at this diet that was almost upside down from what we are told to eat. So it was higher in fat, higher in cholesterol, higher in animal foods, lower in it had no grains in it at all, no beans, and fewer vegetables. It was just very different. And
how did you find out? That was not a regular MD probably that gave you the advice.
I didn't get this advice. I was just experimenting out of curiosity. And so
you were looking on the internet?
No, but I didn't find anything on the internet at that point. This was 2007. I didn't find very much there that was helpful to me, but I was just doing my own experiments, and I arrived at this upside-down diet, and then I saw the diet, and I thought, that's an interesting pattern. Let me look and see. And then I found information on internet afterward about paleo diets, about ketogenic diets. And I was like, oh my goodness, there are other people who already know that or think that this is better, right? But I was really, honestly, I was very worried about this diet. This diet resolved all of the problems I had, not just the stomach issue, but the migraines, the pain, the fatigue, everything was better.
Did you have mood symptoms as well? Like you were feeling depressed or anxious or...
Right. So this was what got me curious about how to help my patients, is that I wasn't trying to improve my mental health. I thought it was pretty good, but actually...
But it improved.
It improved.
That's what happened to me when I went on a keto diet. My brain became so quiet.
Exactly. Yeah. I remember wrote down, I put this in, but I remember this diet feels peaceful. My brain was calm. I was focused. My sleep was better. My mood was better. My concentration was better. ADD runs in my family too. And my mental energy, and I was much more productive and much less anxious, and even calm and focused. And I thought, this diet must be good for the brain, but But this diet is also must be isn't this diet dangerous? All this meat and saturated fat and cholesterol, no whole grains. This diet, I can't recommend this diet to my patients because I could lose my license.
Yeah, that's the same in the US, because I'm not allowed as a psychiatrist in the Netherlands to start with giving dietary advices.
What is the reasoning behind that? Why aren't you allowed to give dietary advice?
Because we need to work evidence-based, so we need randomized, controlled clinical trials. I don't know, do they exist already, or are you working on that?
Yeah, so there's the science in the area of ketogenic diets for mental health is exploding right now. So
in the US, not in the Netherlands, unfortunately.
Around the world. Actually, I met a researcher the other day, Dr. Elina de Keister, who is doing research, I believe at the University of Leiden, in ketogenic diets. And this is very new research that she is starting. So it's not finished or published yet. These are brand new experiments that are happening. But all around the world, at the University of Edinburgh, in Scotland, there's a wonderful researcher there by the name of Dr. Ian Campbell, who put his own bipolar disorder into complete remission, complete recovery more than 7 years ago using a ketogenic diet. And he is now leading, he's already published a pilot study, small pilot study of ketogenic
with
diet
patients.
With patients.
Because the research is very much, in my opinion, done by researchers, biologists, and not by clinicians. And the research with patients, very, very expensive.
Yes.
And you don't have a pharmaceutical company who's going to pay for it.
Exactly.
And McDonald's will also not support it.
Probably they would really not appreciate these, what we were learning about the relationship between ultra-processed foods and brain health is very, very dangerous. But yes, there's research everywhere. So there was a study that I helped to publish is a friend and colleague of mine, Dr. Albert Denat in Toulouse, France. He, a clinician, not a researcher, he just decided after many, many years of working with patients and they weren't getting better with serious mental illness, he invited some of his patients, 31 of his patients with major depression and bipolar disorder.
Treatment-resistant patients.
Yes. Yeah. Taking an average of 5 medications. They'd been ill for an average of 10 years already, some as long as 30 years. Nothing else was working. They come into the hospital, volunteer to try this diet, whole foods, low carbohydrate diet, and 28 of those 31 patients stayed on the diet for 2 weeks or more, which you do need to use it for at least a few weeks. And every single one of them improved. And 43% of them, full clinical recovery.
It's amazing.
It's amazing.
And is that published already?
Yes, that's published in 2022. And the information is in the book in I can't remember the number of the chapter, in the ketogenic diets chapter. Yeah. The very beginning of that chapter, I explain this study and so 43% remission and 64% left the hospital on less psychiatric medication. Really a miracle for these patients.
And how are we going to let this grow? Because in the Netherlands, for example, your own experience as a psychiatrist, you should leave that at home. And where I started is by experiencing it yourself. And then, of course, we need research.
Yeah.
How do we make this bigger amongst clinicians?
Well, the first step, and I'm really grateful to you for this, is helping the information be translated into Dutch so that clinicians and families and patients can be aware of these new treatments and this new way of thinking about brain health, which really is not. It's not rocket science to think that the brain cares about what we eat.
It's pretty simple.
Right? It's very simple.
Yeah.
The medications are complicated, and those ideas are very complicated and hard to understand and mysterious. The fact that the brain needs all of the essential nutrients to work properly, that you need to protect it from damaging ingredients, and that it needs a smooth supply of energy. This should not be controversial.
Yeah, humans have a talent to make things complicated, and they lack the ability to make it simple again.
That's right.
Yeah.
Exactly.
Yeah. And how does your work look these days? Are you still a clinician? Are you a lecturer? Are you a researcher? How?
Yes.
Okay, so you combine. That's why you're working all the time.
Yes.
Yeah.
But it's a really joyful work. I mean, working this way, as you know, when working this way feels very different from working mostly with medications, because it's collaborative. You're working together with patients, empowering them, giving them the tools and the information they need to change their life and improve their brain health. It's really empowering, as opposed to me saying, you have this problem and I need to give you this medication for the rest of your life.
It also changes the relation with your patients.
Yes.
From a psychological perspective, it's also different from, I'm the doctor who knows what you have to do.
Exactly.
Yeah.
I can't change your diet. Only you can do that, right? So I can try to inspire you or encourage you or give you information and support. But ultimately, the person has to decide that they want to be healthier. And this is really, we're working together, cooperating together. And the goal is to make myself obsolete as a psychiatrist, so that you don't need me anymore. You can, ideally, is to improve your brain health, reduce the medications, and see me less often, or maybe not see me ever again when you're truly recover. Yeah. It's a completely different way of, it feels so much more joyful and more cooperative.
And I also think it's possible to work in groups.
Yes.
So in the end, it's cheaper as well, because you can educate people and let them inspire each other.
This is a really excellent point, because when you're just helping one person at a time, you can't help as many people, but also they can't help each other and support each other. And the group support, especially with a lifestyle change, is really important to help with success. Because we are social creatures, so we try to do something by yourself is really difficult.
Oh, the WhatsApp groups are so powerful.
Yeah.
Places where people can share experiences in a safe environment.
Yes, and so my hope is that in places like the Netherlands and everywhere around the world, that because you're saying that there are these big obstacles to conventional treatment system, conventional psychiatry, traditional psychiatry, there are these obstacles to using these, recommending nutrition in practice. What's happening in the United States, which I hope will happen other places too, is that patients are coming, asking for these interventions and wanting to learn more about them and get support. So
you're looking for a bottom-up movement.
Yes. Yeah, exactly.
And you know, psychiatry is a business model as well. So in the Netherlands, many people make their money with trying to help people with mental problems.
Yeah.
Many of them are not working with the patients themselves, so they're in the organization.
Yeah.
And they want to keep their job. And the question is, what's the good place to introduce this? Is it in psychiatry, or maybe we should go to the GPs and do it there already? Because you have all these other somatic symptoms that you can improve.
Well, exactly. So what you're saying is so important, because the ketogenic diet isn't, and the book isn't only about ketogenic diets, although it focuses a lot on the special properties of a ketogenic diet.
Because the carbohydrates are so toxic.
Yes, especially
it's the other way around. It's not promoting ketogenic. It's explaining how dangerous too many carbohydrates can be.
Yes, exactly.
Yeah.
And so that's why so many of us now have pre-diabetes, and diabetes is too much carbohydrate for our evolutionary chemistry. So yes. So I think that, where do we start? Because if you improve your diet in the correct ways, if people have the right information and they make these dietary changes, it doesn't just improve the brain, it improves the whole health. So yes, so general practitioners, really any medical specialist, because these principles of healthy eating apply to the whole body.
Yeah.
So we don't need like a different diet for the brain and a different diet for the liver and a different diet for the heart. That would be ridiculous. So we can start wherever people want to start. And it's really important for patients to get the support from their clinicians, because when you use these principles, they're very powerful and they can cause blood sugar to drop and blood pressure to come down, and excess fluid to your body will lose the excess fluid that it's been retaining, and this can, in the very beginning, depending, especially if you're taking certain medicines or have certain health, this can be very dangerous. These are really healthy changes, but it's such a big change for the system to suddenly become so healthy that there can be this period of time where you need to, the first few weeks, need to make these special monitoring of the medications and blood pressure and blood sugar so that it will be safe and comfortable. And so people need to work with their clinicians.
Yeah, you need a physician. That's important.
Yeah, you do. Especially if you're taking psychiatric medications or blood pressure medications or blood sugar medications, and because it is a powerful intervention, not like other diets.
And when I started to eat keto, I really had a serious detox.
Oh, interesting.
So without knowing it, I was a real sugar addict, I think. And I didn't have overweight. I was a long distance runner already.
Yeah.
But it took me like 3 weeks to get through it.
What did it feel like?
But the last day before I made the switch was terrible. So it was really like I've been working in addiction treatment, and it looked like getting off, I think, cannabis. So
wow,
that also takes weeks.
Right.
And that's why I think you need a clinician to help you.
Yeah.
Or is it possible to go to the internet and companies like Go Keto can give you all the information? How you think about that?
I think it depends on the person, because there are some situations where it will be quite safe for you to transition onto a ketogenic diet, and other situations where it will not be, without extra help and support and education and medication monitoring and medical monitoring. Some situations require more care than others. So because when you write a book, you can't give personal advice to each individual reader, what I recommend in the book is that everybody learn more about the diet, but consult with a clinician who has experience with a ketogenic diet, and make a personalized plan. Some people are going to need more support than other people.
And do you also train other psychiatrists in the US already?
Yes. So
you have like supervision and intervision and...
Exactly. So for the past 4 years, about 4 years ago, I started a clinician training program that's certified for medical education credits, and been teaching clinicians online, either in live small groups, or they can see a pre-recorded version of this training to help clinicians, all different backgrounds, not just prescribing clinicians, to learn how to safely incorporate ketogenic diets into their treatment of people with mental health conditions. So how you adjust the medications, how do you look for safety issues? Because sometimes when people are starting a ketogenic diet for a psychiatric condition, these first 2 or 3 weeks, sometimes people can feel worse before they feel better.
Yeah, that's what I experienced.
Exactly. And I'm glad you mentioned food addiction or sugar addiction, because there was just a conference. One of the reasons I'm in Europe is because there was a conference in London just a couple of weeks ago, International Food Addiction Consensus Conference, trying to convince the World Health Organization that ultra-processed food and sugar addiction should be a clinical diagnosis that people can receive treatment for.
And we should add it in the addiction treatment, because
Yes.
if you're not treating the sure addiction, the addict will stay addicted.
This is exactly right. So many.
They also have to give up smoking. Yeah.
Exactly.
But how do you relate to the American Psychiatric Association? Do they like you? Do they hate you? Are they hesitant? What's your relation?
Well, I think it's changing. With the help of this wonderful organization called the Bazooki Brain Research Fund, which is a charitable
that's a
organization.
family that supports financially what you're doing.
Yes, and many other researchers and clinicians around the world. Their story is that the founders of this organization, their son who had developed bipolar disorder during college years, had to leave college, was on the verge of homelessness, very, very ill, had tried lots of medicines, hospitalizations. Nothing was really helping. They accidentally discovered the ketogenic diet. Dr. Chris Palmer helped the family get onto the ketogenic diet, and he's been in complete recovery now for, I think, almost 3 years. Nothing else. It's incredible.
Yeah.
So they. Why was I telling you that? There was a reason.
The APA. How do they look at it?
Thank you. So the Bazooki Foundation had the idea to propose 3 presentations for the APA meeting for this year, 2024. So we put together 3 proposals, and 2 of them were rejected. But one of them was accepted. And we are hoping that next year, maybe they will include even more presentations. So there is the one presentation this year will be, and this was the work of Dr. Shabani Sethi, who is a metabolic psychiatrist at Stanford University, who just a few weeks ago published a clinical trial, small clinical trial, pilot trial, showing that if people with bipolar disorder and schizophrenia, if they switched to a ketogenic diet, that most of them improved both their metabolic health, their physical health, and their mental health. 79% of them improved. So this was big news in the United States. And
79.
79%.
That's an amazing high number. Because
medication, right?
Yeah, but it's people with severe mental problems that we're talking about.
Exactly.
It's not social phobia.
Exactly. But for any of your viewers who are thinking about this, if this intervention, a simple low carbohydrate diet, could improve symptoms of serious mental illnesses, imagine what it could do for you if you have mild mood swings or depression or attention problems, much simpler conditions that most people are living with now. Most of us are dealing with some sort of issue of mental health. Imagine what it could do for you. And so I think there's a tremendous amount of promise and hope in this intervention.
That sounds good.
Yes.
And do you get your points as a psychiatrist when you follow one of your courses? Is it certified?
Yes, it is. It is certified for continuing medical education credits and also for nutritionists. But I don't know in Europe if I think for a lot of clinicians in Europe I've trained a lot of my clinicians have been from Europe, and I think they have to ask their local
but that's a problem in the Netherlands. That's why I gave up psychiatry, because the things I found interesting didn't give me points. So the psychiatrists go to the trainings where they get their points.
Exactly. So
but it's hopeful because we refer to the APA very much, and if it's going in the US, it will probably go here as well.
That's what I'm hoping is that that if you can get medical credits for it in the United States, that it will that those credits will transfer to organizations.
And we get points for visiting the APA. So.
Oh, really? Okay, so that's very hopeful.
Yeah. And how many psychiatrists do you think are working with this in the US already?
It's hard to say. I mean, there's a very small number of us, maybe 5 or 6, who are actively using these treatments, but there's a growing number. And all around the world. So for the training program, I've probably trained maybe 300 or 400 clinicians around the world, but not all of them are psychiatrists, and not all of them.
That's
are
no problem for you.
States.
You can train MDs, whatever.
Exactly, right. But so everyone is welcome to take the program. But what we really need is as many prescribing clinicians as possible, because people need help adjusting their medicines when they're changing to the diet. Yeah, that's the hard part.
To get off the medication.
Yes, it's very dangerous to stop medication abruptly or without supervision. And so even though the dietary changes can be very, very powerful interventions, then you have to deal with the medicines. And that's much more complicated.
Yeah, well, in the Netherlands we have over 1 million people taking an SSRI, and probably half of them want to stop. And we don't know how to stop it, because there's no research, there's no guidelines, because the pharmaceutical companies teach us to increase medications, and they didn't help us how to decrease.
Oh my goodness. I think that there's an organization, in fact, I believe they're located in the Netherlands, an organization that is helping clinicians with
taper strips.
Exactly.
Yeah, but if you can combine that with, that's what I try to do with running. So you can help people by improving their physical health.
Yes.
To taper off.
Yes.
Yeah. Okay. And of course, people have to start reading your book. And where do we find your training?
So the training, I have a website that is called diagnosisdiet.com, or you just put my name in Google and say website. There's a tab that says training at the top, and you just go to that page and it gives information about the training.
Diagnosisdiet.com.
Exactly.
Okay, I think we have to stop it for now, but I very much hope that this is only the beginning, because we need much more people like you.
And like you, I'm so excited to connect with you, and so grateful for you publishing the book in Dutch. I really hope that it will be helpful to people.
Did the book work in the US already?
Yes, it's going very well.
You get reactions?
Yes, the reception has been very, very positive. It's doing very well in the United States. It's been reviewed and recommended in the New York Times.
Wow!
It's
and that's all on your website as well?
Yeah, all of that information is there on the website as well. Yes,
that's great.
Yes.
And I think we are the second country in the world.
This is the first non-English translation. Thank you.
But are other translations coming up?
Yes, Japanese is coming, Korean is coming, Polish is coming. Excuse me. And we are actively working now on Chinese and Russian, Eastern European languages. Excuse me. So every month we are receiving new international contracts, and it's really very exciting. But Dutch is the first.
Okay, and is this happening with Chris Palmer's book as well? Because
yes.
it was earlier.
Yes. So his book was published a little more than a year before mine, and the last time we were together at a conference, he said that his book had been published into, I think, more than a dozen languages.
Okay.
So it's these ideas are being very well received.
Well, that gives us hope, and more important, that gives hope to the people who are treatment resistant to psychiatric medications.
Yes, I mean, this is the thing, is that so many people don't know that these interventions are an option. So they think they've tried everything, and they think there's nothing left to try. But in most cases, people are not aware of these treatments. They know that food might matter, but the information that they have about food and the brain is not correct. And so maybe they even tried certain dietary changes and they didn't work. But the reason I wrote the book really is because changing your diet can be a really powerful tool for improving mental health. It can help you in ways no medicine can, but you have to know which dietary changes are the ones to make, and they're not the ones we're used to hearing about.
and in the meantime, it's for all the people suffering from mental problems, but it's also for the professionals, because
yes,
we need them
Exactly.
that much.
We need both. We need everybody
Yeah.
to come together and with this new understanding. So the book is written for general public, but also for clinicians and for scientists too, and nutrition professionals.
Okay. Thank you so much
Thank
for
you.
so far. En dan zal ik in het Nederlands afronden. Dank Go Keto voor het gebruik van deze fantastische studio hier in Leimuiden. Ik hoop, Georgia hoopt, wij hopen dat dit tot heel veel navolging zal leiden. Dank jullie wel en graag tot een andere keer.